It became the #1 cause of death around the 1920s, and heart disease is still the #1 killer in the U.S. today. Is there any way of stopping this scourge? We ask a cardiologist for advice. And think about this. For those born in 1900, the average life expectancy was just 47 years old, while babies born in the U.S. today can expect to live to 79. But is it possible to double or triple that or more? Doctors are discussing stunning extensions to our lifespans. And does kindness seem like something we've left behind these days? A man known as the Kindness Guy tells us where it might be hiding and how you can find it. Fox 11 News in Depth starts right now. Hello, everyone. I'm Hal Eisner, and this is Fox 11 News in Depth. February was Heart Health Month, but it's a topic we need to be thinking about year-round, especially because even though we're making progress, heart disease remains the #1 killer of Americans. That's a conundrum, and we thought we'd talk to an expert about it. Dr. Ernst von Schwarz is a cardiologist, author, and longevity expert at Cedars-Sinai Medical Center. Good to see you, Doctor. Thanks so much for joining us.
Thank you for having me on, Hal.
Well, among the many things you do, we said you're a cardiologist. So, you must face this question all the time, which is, with all the awareness on heart disease, as a killer, why is it so persistent?
Well, because we all die at one point, of course, and the limiting factor for life is our heart function. So if the heart doesn't work, none of the other organs work. I just did an angiogram an hour ago, actually, in the hospital, someone with kidney failure, and the family was very concerned. Well, don't we hurt the kidneys more? Yes, we do, I said, but the heart is more important. So if the heart doesn't work, the kidneys don't matter. So still, as you mentioned, people die of heart disease more than of all other diseases combined. And the interesting thing is, there's a lot we can do nowadays, we as physicians, but also we as patients, because at one time in our life, we all might get there and have heart disease.
Well, aging is what it is, right? And our insides age just like our outsides age. And so what are some of the things you want to tell people about what they ought to be doing to take care of the ticker?
Well, we all know about the essential 8, which was promoted by the American Heart Association, which means there's 4 factors. We call them health factors. In the past, we call them actually risk factors,
right.
But now we want to be more positive.
Right.
Health factors. And there's 4 behavioral aspects. And we all should work on those. And the risk factors or health factors are: watch your sugar in the blood, watch your cholesterol, watch your blood pressure, and watch your weight, because all those compromise the risk factors to develop coronary artery disease and heart failure. And the behavioral aspects are, of course, the amount of exercise we do. We all should do more. It's very important what we eat, meaning the diet, of course, sleep pattern, very important also, and we have to basically avoid the toxic substances, which kills all of us. And the worst of all, as you know, is smoking.
Right. It all sounds so easy, right? But we're not doing it as a society as a whole. And why not?
Well, I'll give you an example. I just an hour ago had a patient in my office, and she's 75 years, a very, very nice lady.
Young woman.
Yeah, very nice, and in a good condition, but morbidly obese. She had a heart attack. I put a stent in her 6 months earlier. She has diabetes, and she has high blood pressure. And she has back pain and hip pain. And she was telling me that she was watching a video of a 25-year-old model telling her how to do yoga and some stretching and exercise. This woman, of course, knows she never will look like that 25-year-old model. It's just not going to happen. So even though we encourage exercise, and we have to encourage it more, it has to be individualized. So that lady, the 75-year-old, will not be able to do what a 20-year-old can do in the gym, but it starts today, and everybody, even at advanced ages, can start.
It's lifelong. It's not like it starts at 74.
No, but even if you're 80 years old and you start today and you have never done exercise in your life, you can gain additional years of life. So studies have shown you even late start of exercise and diet can prolong life.
Are we making progress toward treating heart disease?
We do. Actually, we have a wide armamentarium of electrical therapy, of interventional therapy, of medical therapy, pharmacomedical therapy. For example, we do more through the groins or arms in the heart rather than cutting the chest open. So the intervention, and I'm an intervention cardiologist, interventional cardiology is able now to not only put stents in clogged arteries, but we even can replace valves, aortic valve, mitral valve, through the groin.
That was a long time ago, though, they used to take a chisel and a hammer and break the chest apart.
Well, we still do that, of course. Our cardiac surgeons still do that, but we can do a lot of those things non-invasively or semi-invasively so that the patients can go home the next day.
We've heard a lot of stories lately, and we've done a lot of stories lately that are supposed to help your heart. Things like coffee, things like a tiny amount of like 2 to 3 minutes or 5 minutes maybe of exercise. Third being outside in nature, and fourth, the popular weight loss drug, Wegovy. And so what's your sense of these sort of things? Are these progress?
Well, you mentioned the exercise, that's absolutely right, but 5 minutes is actually not enough.
Yeah.
So the recommendation by the American Medical Association, and that has changed, by the way, just a few years ago, is nowadays a duration of 30 minutes per day for 5 days a week of what we call moderate intensity exercise, meaning ideally we need to get our heart rate up, we need to break out in a sweat, we need to get short of breath. This is a real exercise. And the reason why we want to do that, and we should do that, all of us, is because we want to keep our blood vessels elastic.
Right.
Because one aspect of aging, if not one of the main reasons, is that we lose the elasticity of the blood vessels. They become stiff, and that leads to plaque deposition and calcification, and then the blood
hardening of
vessels
the
get
arteries.
tight, and then we have heart attacks and strokes. So
All right.
exercise is essential for that.
We've got a lot to talk to you about, Dr. von Schwarz, so stick around. And that includes a discussion of your book, Secrets of Immortality. Yeah, immortality, not mortality. And it sounds like a tantalizing subject matter. Can't wait to have you get into that. And we'll be right back with more Fox 11 News in Depth right after this break. Don't go away. We're back on Fox 11 News in Depth. I'm Hal Eisner. Let's welcome back Dr. Ernst von Schwarz. Dr. Schwarz, and it's actually von Schwarz, right?
That's correct.
That's a two-name name. In addition to being a cardiologist, you're also a longevity expert at Sinai Medical Center. I'm fortunate to have some good longevity genes in my family. In fact, I want you to meet somebody from my family at the age of 100. Take a look.
Smile, and the whole world will smile with you as beginning now. Smile, everybody, smile.
That's my aunt.
Oh, really?
She passed away a few years ago at the age of 104.
Wow.
That was her at 100. At 100, she was still very feisty. Mm-hmm. Didn't that make you smile?
Absolutely.
That makes me smile every time I watch it.
Yeah.
And yet, as she got to 102, 103, and 104, it got more difficult. So, we talk about my aunt, we talk about people and families that may have, longevity in those families. You have a book. The book is The Secrets of Immortality. And that's what we're kind of talking about when we're talking about people with age. The secrets of immortality, and now medical science making enormous advancements in these fields of anti-aging and longevity science. But this book doesn't really promise immortality.
Absolutely not. And I don't believe in what we call biologic immortality. That doesn't exist, and I don't think it ever will. But what I do believe in, and what we do on a daily basis, is we can and we are able nowadays to prolong life. And I'm not just meaning lifespan, meaning years of how long we live, but health span, meaning quality of life. We want to avoid things like frailty. We want to avoid the immobility. I see that every day when I round in the hospitals.
Right.
So we want to keep patients going, being active into high ages, and live longer and better.
But would you agree that these are like automobiles and they have so many miles on them? And there's a point at which it may be difficult to keep them in warranty. And you've said, and I want to ask you about this, that people could add 150 years or more to their lifespan Is that really feasible? 150? I mean, at 104, she couldn't. You know.
I mean, theoretically, it is possible. I think so, yeah. Because, look, in medicine, when I went to medical school, for example, we were taught what we call reactive medicine. So a patient comes with pain and there's some damage,
Right.
we treat that. But now we have this paradigm shift to what we call regenerative medicine, which includes stem cell therapy, which in my opinion is the future of modern medicine, where we have the ability really to interfere with senescence, which is cellular aging, and we have the ability to repair age-related degeneration or damage.
Right. So we have stem cell therapy. What other innovations might we see over the next 10 years?
Well, there's gene therapy, there's stem cell therapy, there's a plethora of medications which are studied at the current time, which might be able to prolong life. One you might have heard about is metformin, which is a very old drug used for diabetes. It is tested right now in 2 large-scale multi-center clinical trials for potential longevity effects.
Well, what is it in metformin that does that?
Well, nobody exactly knows.
Right.
For many medications, unfortunately, we know they work, but we don't know.
But some things are just empirical, right? They're anecdotal. They're not necessarily based in science.
Well, it is empirical science, but we don't know the biochemical pathways or mechanisms yet. But there's a lot of things. There is no miracle pill which makes people live 120, 150 years old, but it is a combination of lifestyle, of different things, of regenerative medicine, of avoid toxic substances, of course. All this comes together, and this can create longevity.
Okay, I hope I get this right, but tell me about nutraceuticals.
Okay.
It's like pharmaceuticals and neutral, but what is nutraceuticals?
Well, nutraceuticals, this is a wide term which basically means there are certain substances in our diet or as supplements available which might be beneficial in case, number one, there's a deficiency, and some people believe even that there might be anti-aging effects. So, as an example, you might have heard about NAD, which is a cofactor. A lot of people talk about that, especially in Hollywood. A lot of people get infusions, injections of NAD on a weekly basis. If you look at the scientific literature, there is not much there. But there's a handful of smaller studies which show that NAD supplementation can improve metabolic activity of certain organ systems. And that can help to keep the guts healthier, can help to keep the blood vessels more elastic and healthier. So there might be something to it.
Is that available?
Oh, absolutely. Yeah, that's available. But I'm not a biohacker, so I don't believe in swallowing 20, 30 pills because someone says they work and there's no scientific evidence. So the real anti-aging nowadays has to be scientifically based on clinical studies.
But when we talk about biohacking, just to be clear, you're talking about like red light therapy, things like that?
Well, biohacking means basically individuals do out-of-the-box medications. Some people swallow 50 tablets a day and inject whatever substances and believe it makes them younger. That usually is not the case. Our anti-aging is based on the basic research of senescence, and we know that we can interfere now with the biological pathways of senescence, of cellular aging.
So some things are cosmetic and some things are steeped in what you consider to be reality. We only have a few seconds left.
Yeah.
What do you consider to be the thing that is the most efficacious?
Well, we have to find a way to close that gap between basic research and clinical application, what we call translational medicine. So we have to use the data from the basic research for humans to treat. And that is basically the future of medicine.
All right, Dr. von Schwarz, nice to meet you. Thanks for being here.